Welcome back to the conversation. We are talking to Octavia Evans about caring for her son, Damon. Damon is the toughest 4-year-old and sickle cell fighter you have ever met. And the family turned to the Be the Match registry to find a bone marrow donor. But Damon is still waiting for that perfect match. And joining the conversation now is pediatric hematologist Dr. Marianne Yee. She's Damon's physician at Children's Healthcare of Atlanta and an advocate for bone marrow donation. Please welcome to the show, Dr. Yee.
Thank you.
It is so good to have you, especially since you know Damon's case since he was a baby and so many others. You practice here in Metro Atlanta.
Yes.
This is what it is like, right? What Octavia's describing.
What she's describing is really the life of many children who have sickle cell disease. That is right. Yeah.
And tell us more in terms of what the treatment looks like, because we often hear there's no cure for it, but explain what a bone marrow transplant does. Is it the cure?
So bone marrow transplant is what we consider to be a cure for sickle cell disease, as it's also a cure for other blood conditions. There are good medical options to treat and stay healthy with sickle cell disease, but bone marrow transplant is the only cure.
Especially is for a most severe case like what he has, right?
Yes.
And without going too far inside hematology baseball, if there is such a thing, how is it that it helps?
So our blood is actually, all of our blood is made inside our bone marrow. So if you want to receive and make blood that is healthy and doesn't have the sickle cell condition, you can receive from another person a transplant of their bone marrow. And if that is successful and your body accepts it, for the rest of your life, that will be your bone marrow, making your new blood for the rest of your life.
And so why is it that just the blood won't suffice, that it actually has to be the bone marrow? What's inside the bone?
So inside the bone are basically our precursor cells, or sometimes what are called stem cells, that are the cells that will grow up into new healthy blood cells. The cells in our blood, they only last for a couple of months.
Okay.
And then you have to go kind of to the source of where they are made.
You need the original source.
Yes.
That's where the fix is.
Yes.
And let's talk about the need for donors, right? Because this is with every community, but particularly in Black and brown communities. Why is that?
So the reason is, in order to have a successful bone marrow transplant, you have to have a donor who is perfectly matched to your genetics of your bone marrow. So the genetics of a bone marrow type is extremely different than for a blood type. There's only a couple of common blood types. There are millions and millions of different intricate bone marrow types. So the chances that one person and a person next to them would be a match are less than 1 in a million. So in order to find a match, we have to have large registries of millions of people who have signed up to be potential donors.
And in this family's case, in Damon's case, there was initially what was believed to be a match, right? But that didn't quite work out. Explain how that happens, or what you know about how that happens.
Yeah, so when Octavia and the medical team talked about finding a donor for Damon, the first thing we did is we tested his type, and we went to the registry to see, are there any people who have signed up for this registry who are matches? And in fact, he did have a perfect match. Next steps happen after that, though. That donor has to be contacted. They have to have a medical exam. They have to be sure that they're fit to donate and that they're able and willing to donate. And sometimes that's where things fall through.
That donation process is, because there are several steps there, but then when we get to, you get past all the paperwork, you're still healthy enough to do it. Maybe you joined the registry years ago.
Right.
What happens in that process? I guess, again, without getting too graphic, because it's a pretty intense.
Yeah. So a donor who is a match for a child is a particular situation in which the cells that we need to collect from that donor have to be taken from that donor's actual bone marrow. So
that means you're going into the hip, right?
That's right.
You're going into.
So the donor undergoes what we would consider to be a minor surgical procedure. They're sedated because it's a surgical procedure, and they have a needle placed into the back of their hip bone, and multiple times they have liquid marrow removed from their hip bone until they have a sufficient amount that you could give to a child.
Is it a one-time procedure?
It is a one-time procedure.
What's the recovery time like?
About 1 or 2 days.
And then, I hate to say it like that, but is that it? I mean, that sounds like a
that's
lot.
it.
Be very clear.
And then
I'm like, that
that's
is a
it, yeah.
lot. But that's the only ask.
That's right.
Once you
That is
recover.
the only ask, yes.
But I guess that's where sometimes things can get complicated for somebody who says, yeah, I can do this. And then maybe circumstances change. And that's a harder thing to
That's true. Yes.
fulfill,
Yeah.
understand. But that's what you're hoping will happen. And that's what so many families are hoping will happen, right?
Right. And we're just hoping our delay is not a denial.
Delay is not a denial. All right. Very good explanation of a very complex situation, but one that's affecting so many communities. When we return, the conversation about sickle cell disease and finding a match will continue. Stay with us.